No doubt, rabies infection is fatal in both animals and human beings, but we can stay alive with preventive measures. The most important of such measures would be vaccination. Vaccination of pets, vaccination of human beings. Pre-exposure, if you are handling animals. Post-exposure, if you are bitten by rabid animals accidentally. Rabies infection is fatal, like I've said earlier. For full presentation on rabies, all the files will be through this link. They are written here. All the files will be here. I've been talking about disease is fatal, Yeah, that is pretty huge. 99 to 100% of the animal or human being showing the signs and symptoms will die. Some will say, why the 1%? I will talk about that later on. Because majority will know that 100% would die. Prevention is cheaper than this incurable condition. Then we'll examine what to do not to die. Educate yourself today and educate everyone around you. My brand is purposely to reduce pain, suffering, and preventable deaths. That's why I'm here. So let's begin. Let me quickly share some true life stories with you right here about rabies. The sad one was about a young man aged 16. Handsome, smart, loving young man. He was bitten by the dog of his neighbor. He went straight to tell the mom. The committed and concerned mother took him right away the same night to see their family physician. Family physician took history whether the dog was mad or not. The answer was the dog wasn't mad. Then he gave the young man tetanus toxoid and sent him home. Life continued. But that happened in October 1990. 3 months after, that was December 1990, the young man started manifesting signs and symptoms of rabies infection. He was taken back to the same physician who referred him to the tertiary institution, University Teaching Hospital. By December 24, Christmas Eve of the same year, 3 months after being bitten, the young man died of rabies infection. Some people are alive today after being bitten by dog, cat, or bat because either they've gotten pre-exposure prophylaxis or they presented to their physicians early enough and they got post-exposure prophylaxis. Many of them would have died later on in life due to other causes, not rabies infection. No. There was an argument in the month of September between two physicians. I was called by someone to give my opinion. An individual was bitten by a dog, the vaccination status of the dog not known, and the affected individual visited a physician. This happened in another continent entirely. So the first physician gave 1 dose of post-exposure rabies vaccine and said that was all. They sought the opinion of another physician who disagreed and said 1 dose will not suffice. I was contacted to give my opinion. And I told them, if the affected individual had not been previously vaccinated, because you are not a microbiologist, you are not working in veterinary clinic, you are not dealing with wildlife, you are not animal handler. If you have not been vaccinated before, you need immunoglobulin today and 4 doses of the vaccine as day 0, day 3, day 7, day 14, if you are immunocompetent. If you are not immunocompetent, meaning you are immunocompromised, you will come back again for another one shot on 21st or 28th, day 21 or day 28. Now, pre-exposure prevention will warrant keeping away from all those animals listed earlier and more depending on your jurisdiction. Please contact the public health authority in your jurisdiction. Put the animals in good shape. Vaccinate them. If you are keeping pets, keeping dog, cat, ferrets, if you like, if you keep other dangerous animals, but you've gone through the list, find out from your public health other ones in your country that will have rabies virus, vaccinate. Put yourself in good shape. Vaccination, if you must be dealing with certain animals or your occupation will warrant it. I'll go to that list next. So it's not everyone. Like, I have never been vaccinated against rabies, and I don't really need it because I'm not working in that field. But we'll get to that now. Now, pre-exposure, before you'll be bitten, scratched, licked, or you inhale aerosol of any animal containing rabies virus, then get yourself vaccinated if you belong to one of these. If you're a veterinary doctor, I don't need to advise my colleagues in that field. They do the right thing to do. Sorry for poking nose. And members of staff, you are a microbiologist. Not all microbiologists, but those that will be dealing with rabies virus. Please, before you get exposed, vaccinate yourself. Those that will be working on the production of rabies virus vaccine, you are at risk highly, and I know you will protect yourself. Animal handlers, like there are pets daycare centers. You are keeping dogs, different types of dogs. You have staff working with you or for you. Please protect yourself. Animal protectors. We have problem with certain animal. It might even be a rabid dog that is restless and aggressive around. We call animal protectors to come and get it right. They need protection. They need to be vaccinated. You are a traveler going to endemic regions, and you know that they don't have the laws in that region to protect animals from rabies virus, so they will not vaccinate the animals, or you will be dealing with animals there, or you'll be going, wildlife, whatever, and you are leaving your zone where rabies is low. You are risking it into the zone where rabies is more prevalent. Then get yourself vaccinated now. frequent and even, let's say, sometimes occasional camping in the wild could warrant vaccination. Remember, I've said in European countries and North America, Australia, some islands there, Antarctica, they don't have the headache much, but apart from Antarctica and some islands in Australia, even North America and Europe, they are not immune to rabies infection because 90% of cases that will be reported in those advanced countries, even with the legislation and everything on compulsory immunization of the pets, domestic pets, will still have some people that will get the rabies virus from wildlife. So if that is the case, if you are camping in the bush and you wake up and you've seen dead, what do we call this, bats near you, or you notice a scratch and you don't know what is responsible, I would rather have that vaccination than risking your life. I've been talking about vaccination a lot, but we need to get the correct one, please. The World Health Organization has recommendation about rabies vaccination, and WHO recommends that we have to discontinue all nerve tissue vaccines, and WHO encourages the use of modern concentrated and purified cell culture derived vaccines or embryonated egg-based rabies vaccines. That is what they encourage. Now, let's go through some of those vaccines one by one. The RVA simply means rabies vaccine absorbed. That was produced in the United States, precisely in Michigan, in 1988, around March. It is useful for both pre-exposure and post-exposure prophylaxis. It's given through intramuscular route only. The HDCV simply means human diploid cell vaccine, while PVRV simply means purified viral cell rabies vaccine. PCECV simply means purified chick embryo cell vaccine. Remember, what Health Organization has advised embryonated would be good, right? While CPRV means chromatographically purified viral cell rabies vaccine. You may disagree with this list. Please contact the public health officer in your region. Discuss with your pharmacist. Follow the order given by the health authority in your jurisdiction. That will guide as to which of these you can use. Okay, you've gone through who should be vaccinated before exposure. You've gone through the vaccines. You know the one available in your region. Now, how do we give it? Number one, choose the route you want. Through the information on your vaccine, can it be given intramuscularly and intradermally? Because RVA cannot be given intradermally, only intramuscularly. If you have known that, if you are going for intramuscular route, then you can give it the 0, 7, some would then proceed to 21 or 28. If it's intradermal, the 0, 7, 21 or 28. Now the dose will not be the same. Intramuscular route, 1.0 ml. Intradermal route, you reverse it, 0.1 ml. Now, if the person is on anti-malaria agent like chloroquine, please no intradermal route, only intramuscular route. Please pause this, rewind again so you get it fast. Confirm from your pharmacist. Public health. Follow the protocol in your jurisdiction. Okay, you've been exposed. Then you've come, we'll take care of your wound. At presentation, no matter how long the exposure has been, there must be wound care. We will use soap and water, and we will use the water copiously. But if for any reasons we don't have the soap, we will continue with water copiously. You can have disinfectants. Some people will use ethanol for that, while some will use iodine. And immunoglobulin, I will address it after, but we can give tetanus here if it is greater than 10 years that you've taken the last tetanus, okay? And some will make use of antibiotics prophylactically. Suturing will be needed if it is occurring at the head and neck or facial region. I mean, if the scratch is deep and is at the head, neck, or facial region, or the bite is at the head, neck, or facial region. But we will always give immunoglobulin infiltration before suturing. If it is not head, neck, or facial region, we can postpone suturing till about 72 hours. Let's check the different categories of bite or scratch and determine whether we will need post-exposure prophylaxis, that is immunoglobulin and vaccines, or not. In category 1, the animal didn't bite. The animal only came around and touched you. Your skin is intact. The animal licked your skin, but by the time the animal was licking your skin, there was no part of you that had a cut or abrasion or the skin is peeled. Nothing like that. The waste from the animal was dumped on you, but not on the membrane, not through your nose, not your mouth, not your eyes, not on any open skin. If there is no deep bite, no deep escalation anywhere other than the animal just came around, licked you with your intact skin, and the waste didn't fall on any membrane, then there is no need for post-exposure prophylaxis. That is category 1. Category 2, you have the contact with the animal, either a bite or scratch, but no bleeding. You need post-exposure prophylaxis. Or you had the waste from the animal dumped on your eyes, mouth, nostrils, you need post-exposure prophylaxis. Category 3 is the same, mean bite, scratch, waste part being dumped on the membranes, but there is bleeding. No, the same thing happened in category 2, but no bleeding. Category 3, there's bleeding. The reason why we have difference between 2 and 3 is that when it comes to the use of immunoglobulin, some authorities will not use immunoglobulin in category 2 because they say no bleeding occurred. Why category 3, they will use immunoglobulin. Some will use immunoglobulin in either category 2 or category 3, but everybody agrees with category 1 that once there is no cut, no part of the skin is exposed, then you don't even need post-exposure prophylaxis. You've been exposed, and the suggestion is that there should be animal observation. So somebody has suggested that, okay, continue to observe the dog, or they ask you, now, how was the dog behaving? Was the dog mad? And your answer had been no, not mad. Or, okay, you go home and be observing the dog. Well, in the olden medical practice, in some places up to now, they still observe that. It is good to observe that the dog is behaving well or not, is mad or not. Even if that is the case, once you are suspecting that this could be rabies, or you are not sure of the immunization status of the animal that has bitten the fellow human being, then you just forget about observation. Or the incidents occurred in the wild. Even if you were able to capture the animal or whatever, you just go ahead and treat fully. Give post-exposure prophylaxis fully. Do you know why they always wait for 10 days? Signs and symptoms in animal may never manifest in dog in the first 10 days. That is the reason for the 10-day window that observation had always taken after dog bite. The incubation period in dog is between 2 to 8 weeks. Once the dog starts showing signs and symptoms, then that dog must die because there is no cure, and the brain can be examined, for rabies, infection, and that will be the gold standard in animals. You've been exposed, but luckily you've been vaccinated before. If that is your story, no immunoglobulin today. 0. We will go ahead and still give you vaccines, but instead of 4, you will take only 2, day 0 and day 3. However, even if you've been vaccinated before and your immunity is compromised now, we will treat you like someone without previous vaccination. If you choose to take the vaccines intradermally, then we will use the right deltoid 0.1 ml and left deltoid 0.1 ml on day 0, and we will repeat the same on day 3. You might not use deltoid area. You can use supraclavicular area or the thigh. Let's talk about rabies immunoglobulin in post-exposure prophylaxis. If the affected person is a known previously vaccinated person, no rabies immunoglobulin, no more. But if not previously vaccinated and not bleeding, some authorities will not give immunoglobulin. If not bleeding, but the bite occurs at the head, neck, face, or gluteal region, please give immunoglobulin. We must give immunoglobulin if the bite site is bleeding. Yes. After 7 days, getting to the 8th day post-bite, well, the effect of immunoglobulin is becoming less and lesser. If you are using equine immunoglobulin, then you need higher dose of that. Find out which one is available in the pharmacy. Find out from the pharmacist. In that case, you will need 40 international units per kilogram. If you are using human rabies immunoglobulin, you need a lower dose, half of what you need for equine immunoglobulin. In that case, it will be 20 international units per kilogram. When you have calculated the amount needed, we will divide the total into 2. Half will be administered at the site of the bite or scratch. It should be infiltrated into the wound directly. The remaining half will be administered at the gluteal region. And that is the only one that will be given at gluteal region when it comes to rabies prophylaxis. The vaccines must never be given at gluteal region. They can be administered at the deltoid, supraclavicular area, or the thigh. But immunoglobulin should be given 2 places only. Half at the site of the bite, half at the gluteal region. But if you are exposed to a situation where the area bitten by the animal is so large that infiltrating it with a half of the dose calculated will appear inadequate, half a loaf will be better than none. We can dilute using ratio 1:1 of immunoglobulin to saline, or ratio 1 immunoglobulin to twice of the cell. Dilute, then use the entire new stuff you obtain now to infiltrate the site. Be ready for anaphylaxis or allergic reaction, although test dose is not what we usually do. If the animal is certified to be fully immunized, or the brain of the animal has been studied and deemed free of rabies virus, no immunoglobulin. We will not wait until we have obtained immunoglobulin before proceeding to give the remaining vaccines. It is still okay to give immunoglobulin 2nd day, 3rd day, up to the 7th day post-bite. Okay, you are done with the observation. Now, like dog or cat, you observe animal for 7 days, no rabies prophylactically unless the animal develops rabies. That is the teaching in some angles, but if you are dealing with wild animals like raccoons, skunk, wood dog, or foxes, then you start immunization immediately. Okay? If the dogs and cats are symptomatic, you kill and you examine the brain. Then you discontinue the vaccination when the result is back and the dog or the cat is negative for rabies virus. But I will not take the risk. I won't wait for all those things to happen. Once you've not been vaccinated before and I'm not sure of the immunization status of the animal, then I'll go ahead with the vaccination. Vaccines could be given intramuscularly or intradermally. I will address that later on. And you select the type of vaccine that is acceptable in your jurisdiction. At what intervals? At what intervals? Because there are a lot of controversies, like I said, as part of the introduction in the beginning, that some wanted to give only one dose and forget about it. Here is the fact. Day 0, 3, 7, 14, 21, on 28, we need to give the vaccine. With or without immunoglobulin. Let me repeat. For immunocompetent victims, vaccine is expected to be given if not previously vaccinated on days 0, 3, 7, and 14. But if the victim, the person bitten by the rabid animal, or you're not sure of the vaccination status of the animal, is immunocompromised, then you give 5 doses on day 0, 3, 7, 14, and 21 or 28. It should be given at the territorial region for all adults and children greater than 2 years. You may go for anterolateral tie for children less than 2 years. Never give the vaccines at the gluteal region. The type of vaccine you are going to choose, you can go through the list I gave earlier, or contact the pharmacist or public health officer in your jurisdiction. Suppose that the victim is immunocompromised. Wow, we have a lot to do here. Number 1, we will take care of the wound like I have described earlier. Good. We will grab our immunoglobulin for all cases involving immunocompromised individuals. Either bleeding or not bleeding, we must give immunoglobulin. We will give all the doses of the vaccines. 5 will be given this time. Day 0, day 3, day 7, day 14, day 21, or day 28. We will report to whoever is handling the condition that has led to immune compromise, either diabetes, cancer, chemotherapy, uncertain medications like steroid, HIV, AIDS, and so on. We will check the rabies virus neutralizing antibody response titer. We will take sample for that in 2 weeks or a month after vaccination. If we are not doing well, as per the result of the antibody, we will give more doses of vaccines. We just don't want this person to be done with rabies. If not, it is not the immune condition that will kill him or her. The rabies virus will end the life. If the victim is in rural area, far away from health center, or transportation is a problem, then we have a way out. What are we going to do? We will still give 4 doses, but we will space the intervals. There's 0, 2 doses. 1 on the right deltoid, 1 on the left deltoid. The 3, 0, don't count. We come back on day 7, 1 at any of the deltoid side, right or left. Day 14, don't worry. Day 21, another one at the other side. If you have given the day 7 on the right deltoid, I'll give day 21 on the left deltoid. Okay, let me point out some differences here. If the vaccine you are about to use can be given both intramuscularly and intradermally, you might be able to solve some problems with that. But some cannot be given intradermally. All of them can be given intramuscularly. So if you want to give intramuscularly, which majority will do, including myself, 1.0 ml will be the dose, okay? But if you choose intradermal route, you are going to give less, is 0.1 ml intradermally. I will talk more about intradermal route. So with this, you are giving more vaccine, but here you are using less of the vaccine. So that is one difference. The dose, see, 1.0, 0.1. When you are giving the vaccine intradermally, please be sure you find blood, or else you might have given it inadvertently, subcutaneously, or intramuscularly. If what you have done is that, please, you have to give another dose. If not, 0.1 ml intramuscularly is not the same as 1.0 ml intramuscularly. They are not the same thing. Okay, you will be giving less if it is not truly intradermal, and you will know it is intradermal when you see the blood. If you are working in an environment where getting the vaccine is problematic, either because it is scarce or expensive, or because it's expensive, that is why it is scarce, then you can advise the government of the day to send to your region the anti-rabies vaccine that could be given intradermally. Why that? We will use low dose of a 0.1 ml per dose instead of 1.0 ml per dose for the IM route. For the intradermal, it is 0.1 ml per dose. Even when you use right and left deltoid, you will use 0.2 ml in a day, unlike 1.0 ml per dose if you give it intramuscularly. So that is applicable where vaccine is scarce, because more people will be able to get from one vial than going by intramuscular route. Even when it is expensive, one vial will cover many doses compared to intramuscular route. However, if you give these intradermally, if you don't see the blood, please don't deceive that man or woman and he or she will come down with rabies later in life and die. Call him or her, let her know inadvertently you didn't plan it. You've given it subcutaneously or intramuscularly. In that case, you will give another dose intradermally because 0.1 ml intradermal dose that has been given subcutaneously or intramuscularly is not good enough to save that life. If you are in malaria endemic region and the patient is already on chloroquine and you need to administer rabies vaccine, then go for intramuscular route on. We will not give anti-rabies vaccine in anyone taking chloroquine for malaria or for rheumatic diseases with intradermal route. No. Why that? The chloroquine will decrease the antibody response to intradermal anti-rabies vaccine. So it's like giving water. And that is why when the immunity is down, we will need extra dose like day 21 or 28. We've been talking about the vaccines for some minutes now. Let's go over possible side effects. At the site of the injection, there might be pain or redness, including swelling. That is, inflammation can occur. Then there might be itching. Then the systemic complications might include nausea, vomiting, headache, abdominal pain. Then there might be myalgia. Some will come down with dizziness. Then there might be fever, chills, or encephalitis. Some will develop severe allergic reactions. Some can have syncope. Others will have arthralgia, heals in some others. Then the brain could be in trouble. Besides the encephalitis, there might be meningitis, even encephalomyelitis. And unfortunately enough, some people can come down, with the end of life, death.